Hi, my name is Andrea Amszynski, and today I'm going to be talking to you about the voice facilitating approach of change of loudness. And now, there's a couple of reasons why you might want to consider change of loudness for your clients as a speech therapist. It's appropriate for patients who have normal or adjusted hearing. This is the first thing when you're going to adjust any type of loudness to make it softer, to make it louder. You want to make sure that their hearing is intact. So prerequisite of any patient, what you want to use this for, they need to have a hearing check or already amplified hearing. Children who have vocal pathologies as a result of yelling or screaming, they might have gotten vocal nodules, they are good candidates for this approach. Um, Adults who have damaged their vocal folds um, as a result of misuse, overextension of the voice that causes, nodes that turns your breath into a breathy, weak kind of tone. They can benefit from change of loudness therapy, making it louder. And for people who need to speak loudly in certain environments, um, some people, they do it wrong. They do it from their larynx instead of with breath support. So there's also, although it's less common, some people with motor speech disorders, especially spastic dysarthria and ataxic dysarthria, sometimes can also benefit from change of loudness as a vocal facilitation technique. So we're going to start with how to treat someone who needs to decrease the loudness of their voice, make it softer. If you're working with a child from age 3 to 10, there's a program called the Boone Voice Program for Children. And what it does is breaks down the voice into 5 different volumes. You have your 1, which is a whisper. 2 is a quiet voice where you don't want to wake a sleeping person. 3 is the voice that you use with family and friends. 4 is the voice you use to talk to someone across the room. And 5 is for calling to someone outside. And the idea of educating children about, what voices are appropriate for what environments are helping them understand what they're using, when they're using it. If they're one of those children who yell and scream a lot and have some vocal pathology, you're going to want to explain to them why you need a 3, why you need a 1. And this is a good way to break it down for those young children. For older children, you just want to make sure they're aware of it. You might start by recording a little sample of their voice and asking them, oh, does this sound loud to you? You can record yourself as a therapist and compare the two. Oh, is my voice loud? Whose voice is louder? Just ways to bring awareness to the loudness. The next thing that you might do when you're trying to get someone to speak softer or decrease the amplitude of their voice is to talk to them about how a loud voice is perceived as a way to motivate them to kind of take down their amplitude a little bit. You could remind them that sometimes a too strong voice can seem overly confident, like you're putting on a front and you're actually scared. You could explain that people hear loud voices as intimidating, or they might think that you're mad at the world. These can kind of help build some intrinsic motivation for decreasing amplitude in your voice. All right, and then the next step after you've prepared your client is to start practicing. So I found a couple of low-tech apps that we can use to start this process. The first thing is a feedback app. So if you work in a clinic that has VisiPitch, that's going to be your best bet. But I also found something called Decibel, it's a free app. It's called Decibel 10th. And what it does is, as I'm talking, it kind of tells me where I am in decibelage. It may not be the most accurate on the phone, but if you practice it ahead of time, you can just have your client working on a certain number that you deem is appropriate for them. And it's very easy to download yourself. It's good for home practice, and it's a good way to practice during therapy to make sure they're really hitting it and getting this visual feedback. I'm going to want to make sure it's at a fixed distance and set them up for the same fixed distance if they're going to be taking it home to practice. But biofeedback is one of the best tools for helping your client make little adjustments in the moment. So that is how to treat a voice that is too loud. But sometimes you may deal with a client whose voice is too soft. So again, the same kind of approach. You want to record the client talking or reading a passage out loud, and then have them listen to it back and see if they can notice which parts are too soft. Again, you can always do it along with them. Say, oh, is my voice in this recording louder than your voice in your recording? Things like that. Some of the associations that you can help your clients with to kind of get them used to the idea of speaking louder, or that people might perceive you, if you talk too quietly, that you are afraid, timid, or shy, or that you care too much about the opinions of others, that you might be scared of people, or that you have low self-confidence. So that can kind of help them understand why they want to change their voice into something louder. So some people speak at the low end of their pitch, and one quick fix is to try to get them to go to a higher pitch, because automatically loudness will be added. So you can do this again with busy pitch, having them match to a certain tone. You can do it with a keyboard. Right now I have a ukulele, so I'm going to get that. So you're going to want them to find a higher pitch. This is a good sound. E, ah. So you're going to want them to practice at this higher pitch. Let's go a little higher. Ah. So I'm going to do the vowel off for 5 seconds. Ah. And then after they kind of master finding that pitch, that's a little bit higher than they're used to. You want to have them do it with maximum loudness. So ah. And then you can start having them go up note by note, just to get used to using those higher pitches that are going to naturally have more amplitude than the low pitch that they've been using. You're going to want to explore the best pitch together, because not only are you looking for loudness, but also keeping good vocal quality. So if it sounds too strained, you and your client can help your client find a good middle ground between loudness and quality. Some people may have difficulty with changing their voice, just because a lot of people feel that their voice is who they are, and especially if they're a person who has been talking softly, they may feel uncomfortable with the way talking loudly makes them feel. So you can be prepared to, talk about the source of that, do some counseling, maybe understand what they're associating with loud voice that's discouraging them from using it in their own life. Because your client must practice outside of the clinic. One thing that's important to notice is something that you might be using in the clinic, an amplitude, could be a lot louder than the real life voice that they're going to be using. So you could even go a little bit above and beyond during therapy to kind of make up the difference for how they're going to soften it down in real life. And that's going to help them build it up over time, practice, get that good muscle memory, and change those higher pitches and louder voices. There is also the respiration treatment, which another one of my colleagues will be sharing with you later. Actually working on breath support to get more force as a way to get your client's voice to be louder. Another treatment approach makes use of the Lombard effect, which, if none of the previous methods are working, not the musical instrument note or not the counseling, you can try to get some masking noise. It's recommended to use 75 decibels of speech level masking noise. And a way to do this, I found another free app. It's called Babble. And what you can do is Turn on the English. Turn on the English. And it will encourage your client to talk louder over the voices just naturally as a natural result of hearing the voice around you. That's what it looks like. You can see it's in different languages. You can have French white noise, English white noise. You can even add some brown noise. And that can be a way to practice using a louder voice if none of the other treatments are effective. So that's babble babble. Finally, you may want to help a client with change of loudness if they are very monotone. So again, a way to do this is through digitized recording, short little snippets. You can have them read one sentence at a time and then just play it back immediately so they can assess how it was. Again, using some biofeedback tools such as the dB tenth, decibel tenth, so they can see that their ticker should be going from loud to soft. You could focus on certain words in a sentence that you need to emphasize that should be registering as louder, and that's a way to help with monotone clients. So this voice facilitating approach is beneficial because it has been proven clinically in a study about call center employees that when they have a biofeedback device, such as a decibel tenth that we talked about, or VisiPitch, they were able to quickly make adjustments to their voice at their work, making them more effective. Controlling your amplitude can prevent vocal abuse. So if someone doesn't have vocal pathology yet, but you're noticing they're talking way too loud, it can be a prevention method to work on lowering the amplitude. Finding a comfortable speaking voice can prevent problems later on. And so it should be noted that change of loudness is often a secondary symptom of a bigger voice pathology. And sometimes other voice facilitation techniques can be helpful in tandem with change in loudness. But as you can see, it's pretty low tech, the things you can do to fix it. And I hope that this helped. All right, thanks.